Oh, good morning, good morning, good morning. And it is a delight to be with you this morning. Welcome to the 11th event in the Advocates and Allies webinar series. These events aim to provide mental health and psychosocial support workers with a diversity of information about what matters relevant to their work in the sector. In the spirit of reconciliation, I acknowledge the traditional owners of the land on which we meet today, the land of the Gadigal and Wongal people of the Eora Nation, and pay my respects to their elders past, present and emerging. I recognise and respect their continual relationship and connections to land, water and culture. I also recognise and appreciate those with lived and living experience of mental health conditions and trauma, their families and carers, including those here today. Your voices are powerful and vital to the advocacy and reform processes across the mental health service sector. This webinar will discuss advocacy and reform endeavours vital to securing career rights, carer rights, and bringing about systemic change for carers and their families. It will also showcase research highlighting gaps and identifying potential opportunities that can inform reform initiatives. We will hear about the carer experience and how peers walk alongside those they work with, and what resources and information are available to support carers in their journey. This is a topic close to my heart. I have lived experience as a carer with both parents having endured and for my mum continuing to endure mental health challenges. So I too am keen to listen and learn from our respective presenters. Today, there are three wonderful speakers, and I'm pleased to welcome and introduce Dr. Richard Baldwin, Eileen McDonald, and Cheryl Ann Paradella. So without further ado, I will introduce our first speaker and welcome Dr. Richard Baldwin. If you would like to turn your camera on, and I will then introduce you. Dr. Richard Baldwin is our Senior Policy Officer at the Mental Health Carers New South Wales. He's an official visitor and academic. Richard has held senior roles in the health and aged care sectors, including services management, teaching, research and consulting for over 40 years, including several senior policy and planning positions in the New South Wales Health Department before his appointment as Director of the Health Advisory Practice for PricewaterhouseCoopers. After his retirement as a lecturer at UTS, he continues to work part-time at the Mental Health Carers New South Wales and as an official visitor. He's a registered nurse, has an MBA from University of New South Wales and a PhD from UTS. Welcome, Richard. Thank you for joining us, and over to you.
Thanks very much, Evelyne. And when you read that out, it sounds like you're talking about somebody else and not me. I'll just share my screen, if that's okay.
Please.
Just checking that you can see that.
Wonderful. Thank you so much.
Okay, so I've got 15 minutes and what I want to start with is to also acknowledge the Gadigal people and to also acknowledge people with lived experience of mental illness and recovery and their families and carers that love and support them. So what I'm going to do today is just talk a little bit about Mental Health Carers New South Wales, where we've come from, what we do, talk a little bit about how to get information for carers. I'm going to touch on carers' rights and what that means for the community sector, and talk very briefly about some of the issues that are important to carers. So we've been around for a while. We've been recognised by the New South Wales Ministry of Health since 2009 as the peak body in New South Wales representing the interests of mental health carers, a community-based organisation, and we enable the voice of mental health carers in New South Wales to be heard by policy makers and service providers. Fancy language, but basically we talk to governments and other organisations to try and further the interests of carers, of people who have a mental disorder of some description. We've got a statewide focus and we link with national organisations, and we engage in systemic advocacy, a fancy term, but basically we're not an organisation to provide individual services to individuals. We're more looking at the big picture, and we try and influence the system so that carers get the support that they need. So we've been around since 1975. Margaret Lukes was a social worker who recognised that carers of people with mental illness were doing it tough, and set up a self-help and mutual support organisation called the Association of Relatives and Friends of the Mentally Ill. Fortunately, we renamed ourselves Mental Health Carers formally a few years ago. And we've been funded by New South Wales Health since the 1980s. I just wanted to touch a little bit on the recognition that is given to carers generally in New South Wales. So while we specialise in being an organisation that looks after the interest of carers of people who are mentally ill, but there are other carer bodies in New South Wales. New South Wales government passed the Carers Recognition Act in 2010, and that creates a charter that works across all levels of government, recognising carers, and that is carers generally. There's also a community-based organisation called New South Wales Carers that provides a range of programs and services for carers generally. The New South Wales Mental Health Act, and I'll touch on this a little later, recognises the rights of carers, and they were strengthened in the reforms in 2015. And the Family and Care and Mental Health Program that many of you may have heard of, funded by New South Wales, is operated by 5 community-based organisations and covers the state with a various number of service outlets. There are other organisations that target carers, but I just wanted to touch on that to demonstrate that we're one of a group of organisations that formally recognises the needs of carers. We have 4 main areas of focus: policy and advocacy, networking and carer support, education and information. And I'll touch on each of those fairly briefly. So advocacy and policy, fancy words, but basically we aim to influence government policy and we do that in a number of ways. We get invited by the Ministry of Health and other organisations to sit on committee and policy bodies. We get invited to comment on drafts that they're thinking about, either for legislation changes or policies. And we provide submissions to a range of government inquiries that are relevant to the interests of carers. We work closely with a number of other groups, including Mental Health Coordinating Council and Being, for example, and a number of others. And we also have a special focus around psychosocial disability to try and improve the policies around people with psychosocial disability in New South Wales. In the areas of education, we do a number of things. We've recently done a number of short educational activities in the Central Coast, and I'm just using these as an example because our education program changes throughout the year. But the ones that we did recently in the Central Coast were, User's Guide to the New South Wales Mental Health System. These are targeted at carers, of course, but of course other people can sometimes join them. So we look at recovery-oriented practice, inclusive care planning, navigating carer support systems, etc. We've also recently done a number of events with Head to Health in Western Sydney, and they finished, I think, yesterday, but we'll be doing more in the future. So you can find out more about the education programs that we offer for carers on our website, and I'll provide that web address at the end of the presentation. We've also got quite a bit of information for carers, and we've been developing this quite actively over the last 2 years. We've got a library of resources on our website that are of interest to carers on a broad range of issues. We also provide a carer support directory on our website. We recently were funded by the Ministry of Health to produce a number of information pieces for carers. And we produced 16 brochures. These are available online on our website. And there's also a link where you can click on to download a hard copy PDF document for printing at the local level. The reason behind these information brochures was that the ministry and us realised that there was a lot of general information available in the community about the mental health system and about issues generally about mental health, but very little of it that was directed directly at carers, using language that carers understand and in a format that was easy for carers to access. We did a number of workshops prior to finalising or starting this project. And the feedback that we got is that carers usually want something that's short, easy to read, available now, and the idea of brochures that could be downloaded off the website was accepted as the best way to provide this range of information for carers. I won't spend time going through all of these topic areas, but the first 10 of these brochures are targeted at carers to explain the mental health system. For example, what's going to happen if I end up in the emergency department and the person I care for ends up in the emergency department? What do I need to know as a carer if somebody's admitted to a mental health unit, for example? What do I need to know about caring for somebody at home after they've had a mental illness, etc. And we've also developed a number of products for carers around particular topics. So children and adolescents who may need inpatient care, LGBTI consumers and carers, and culturally and linguistically diverse carers and consumers, one on diagnosis and one on suicidality. So they're just brief pieces of information, but they're unique in that they address the carer directly. This is an example of what the brochures look like, and you can download them, as I said, and print them off at the local level if you have carers that have a need for this information and want it in their hand. Now, one of the things that we do is we talk all the time to our carers about the things that are important for them. And here's a short list of things that carers have told us recently that are at the top of their list. The first one is carers want to be able to understand how to access and navigate the service system. This is by far one of the most important issues for them, including the NDIS, understanding alternatives to ED, etc. Navigation and assistance with navigation across the service sector is a constant identified issues for carers. Another one is carers' rights, and one of the things that carers constantly tell us is that they feel often ignored by service providers. Sometimes not deliberately, but nevertheless, that's the impression that they feel. Of course, sometimes the person that they care for wants to exclude them from involvement in their care, and I'll touch on that in a minute. Education is another need, and respite is another need. And in the area of psychosocial advocacy, the 4 areas that we're focusing on this year are housing, police, forensic and corrections, and disability care generally. In terms of rights, The Mental Health Act, now I know within the community sector, and most of the people that you have providing care for are not necessarily under the Mental Health Act. But the Mental Health Act does provide a series of concepts and ideas and around the rights of carers that I think is a good idea for all of us to be aware of and to try and follow. So the Mental Health Act identifies the rights of carers to be recognised and to be included. And it specifically lists a number of key events that carers must be informed about and notified. The Act creates the concept of a designated carer. This is an important issue in the mental health sector. This is where the consumer gets the opportunity to say, these are the people that I'm happy for you to talk to about my care, and I don't want you to talk to other people about my care. And so it's a very important mechanism for recognising consumers' rights to who should be involved in their care. Now, of course, carers can be invaluable during a mental health crisis. And for this reason, and also based on what carers tell us, we think it's important that carer details are recorded correctly by service providers. So that, you know, when a crisis occurs, and it's always 8 o'clock on a Saturday night, you know who to contact and, just as importantly, who not to contact. And that recognises the consumer's rights to be able to say who it is that they regard as their carers. So it's important that staff can find these details quickly and that the carers' details are kept up to date. So in the area in which we work, there can be challenging relationships between consumers and carers. And carers' rights don't override the rights of consumers. Consumers' rights are paramount, but carers have rights as well. And carers can be very valuable in providing information about the consumers that you care for. As I said, consumers have the right, at least under the Mental Health Act, to exclude carers from receiving information about them. But just because a carer is excluded by the consumer doesn't mean to say that they can't provide information to you as a service provider. It does mean that you are limited in what information you can provide to them, but it doesn't mean to say that you don't, you're excluded from having contact with them at all. And I think that's an important distinction to remember. In summary, Mental Health Carers New South Wales is the main agency advocating for mental health carers in New South Wales. We're funded and recognised by government as the voice of mental health carers. We provide a range of information, education and support for carers. We recognise that carers have rights, and those rights are recognised within the mental health system. And lastly, carers identify service navigation as one of the most important topics that they can. And that's our the address for our website, where there's a lot of information that's available for you to provide to carers or for carers to access directly. And I'll just check with Evelyne if we're taking questions now or at the end.
At the end, thank you so much, Dr. Baldwin. It's very helpful to hear about the work of Mental Health Carers New South Wales. Lots of resources and very strong advocacy. So thank you, Dr. Baldwin. We'll move to our next speaker. I'd like to introduce our second presenter, Evelyne McDonald. Evelyne is a CEO of Bipolar Australia. She has been involved with the organisation since its inception on the advisory committee and has contributed to its resources and as a speaker and representative. She has 40 years of expertise and leadership in Australia and internationally. She is an experienced presenter and has served on boards, governance groups and in executive roles in the not-for-profit organisations. Evelyne will discuss recommendations from the National Co-Designed Research Project between the National Mental Health Consumer and Carer Forum and with researchers from Monash University, which Evelyne also chaired. So over to you now, Evelyne, and thank you so much for joining us. Wonderful, thank you.
Thank you. Can you hear me all right?
Perfect, thank you.
Oh, wonderful. Well, thank you so much to MHCC and Evelyne for this invitation. On behalf of the research that was nationally co-designed and produced through the National Mental Health Consumer Care Forum and Monash University researchers, and a project steering group that was quite national, and as the CEO of Bipolar Australia. So this research did not come from Bipolar Australia, but it was my privilege to be the chair of the actual research project. Could we go to the next slide? Thank you. So I'm acknowledging also the lands I'm on, which is the Gundungurra people of New South Wales, and all the lands that we are all on. I also acknowledge the lived and living experience of consumers and carers who have gone before us and made way for us to have a voice and continue to lead and contribute to mental health reform. On the screen, you can see that the National Mental Health Consumer Care Forum has mental health consumers and carers from every jurisdiction appointed by their jurisdictions, as well as representative lived experience leaders from each of the organizations represented on this screen. Could we go to the next slide? Thank you. Now, the purposes of this research, and you might be thinking, okay, COVID, we're all over COVID, we're all sick of COVID, blah, blah, blah. And yes, people are still getting sick from COVID. However, this isn't about COVID itself, and it's not about the pandemic. The issues for mental health carers were pre-existing to the pandemic, have continued post the pandemic, unless reforms are made, and policies and practices in our community organizations as well step up to include the needs of mental health carers in a more robust way. Could we go to the next screen? There were key themes for all the 10 priority populations that the federal government funded this research for, and all of these that you see on the screen apply to mental health carers and continue to apply. Particularly, I'll call your attention to the ones at the bottom of the screen, that we need to maintain support that communities are accessing, which is where we are. We're in the community. Uplift where more support is needed, and our recommendations from this will help you with that. And rebuild where connections were lost or disrupted. Also, this is essential for preparing for future disasters. We all have the floods and fires and storms that affect us throughout Australia. And if we can intentionally learn from what's been experienced from the pandemic. Can we go to the next screen? Thank you. This gives you a snapshot of the extensive reach of this co-design project. So you can see there were many national community-led organizations, some lived experience-led, others include lived experience. So we included regional, rural, and remote, and just across all the cultural and other kinds of specialized populations we have throughout Australia for this research, and acknowledging all of these partners. Thank you. Next slide. Some think that co-design, and especially consumer and carer-led co-design, takes a long time. This project took 9 months. So it's a bit like giving birth, fast and furious, but it has some good outcomes that can inform all of us. Next slide. And you'll be getting copies of all of these. What did we find? Well, this gives you a snapshot that for mental health carers, most of them, family, friends, kin, provided approximately 26.3 hours of care per week, above and beyond what would normally be expected in any family for anyone experiencing anything. And during the pandemic, this almost doubled. Most do not receive a care payment or a care allowance, and the majority said their employment opportunities changed, not because of the pandemic itself, but because the pandemic affected the provision of supports for the people that they were supporting as well as for themselves. Next slide. Some of the snapshot of the most stressful times as the pandemic affected different parts of Australia at different times. I'll call your attention to the quote at the bottom of the screen. This has impacted my job, my relationships, my mental health, my ability to care for myself, my other family members, children, my ability to contribute to the care of my elderly parents, my ability to contribute to society. Everything has been impacted negatively. Next slide, thank you. So I'm going to take you through, and I'm not reading all of these to you, but I'd like when you look at these, read the quotes on the side from the different participants in the focus groups and the surveys. As we looked at concerns about service provision and the experience of consumers and what affected those domains. The next slide. The exclusion, and Richard touched on this, from service settings and treatment decision-making, that although the family carers in mental health situations are generally excluded, unlike the rest of the hospital system that welcomes and embraces the support that families give to their family members and their friends and their kin. It doesn't usually happen in our mental health services, and it should. Next slide, thank you. Very diverse experiences from young carers, which our national definition is age 8 to 25, culturally and linguistic carers, and regional and rural remote carers. Next slide. Increased levels of care. Somehow the federal government assumed that everybody needing some kind of support from a family member would be under the NDIS. And we know that's not true for those who have mental health concerns and psychosocial disabilities from mental health. Next slide. There was a complexity in the care provision, the intersectionality of multiple tasks, services, and roles and navigation needs. And again, Richard touched on the needs of navigation supports for family carers. Next slide. Our personal experiences as carers, the loss of our own opportunities, our world shrinks. And this particularly happens because the vast majority of family carers in mental health situations do not realize they are even carers. You can have posters, you can have signs that say, contact this if you're a carer. But most of us are just in a relationship with somebody. They're our friend, they're our kin, there's the family relationship, and we don't think of ourselves as carers. And so we may not know that these things are there for us. The next slide. And I'll touch on suicidality and just mention there will be some slides that talk about that. We're talking about not just the suicidality that affects family carers when it's a family member. We're talking also, if you go to the next slide, the suicidality and the domestic violence issues that happen in families and affect the carers themselves. Next slide. The impact of system failures and challenges, trying to access services for ourselves or for family members. Certainly COVID compounded that, but can I say all of those issues are still existing now for family carers. Next slide. Some of the factors that supported positive experiences. Some of the NDIS providers were very consistent and delivered meaningful activities for the people we support. There were some government initiatives for financial assistance and COVID payments, and most importantly, were the services and the clinicians who actually listened to the family to understand what their needs were. The next slide, thank you. Respite was an issue before COVID. However, federally, we had federally funded flexible respite based on the needs of the family carer. However, with the starting of NDIS, all respite became based on the needs of the person receiving NDIS. And during COVID is when an agreement that was made federally before COVID that all respite funding would then go into NDIS funding. And carers across Australia, both mental health carers and all carers, lost the flexible respite funding they'd previously had based on their own needs. That is still an existing need. I believe Richard also touched on this. And we still need to look at flexible funding for the carers, whether it's just a day out or whether it's longer term. And the emergency respite that is currently available for all carers is only based on luck of the draw, where you happen to live, and if the respite is actually available. Next slide. So we want to enhance strategies and skills. And yes, during COVID, people did have opportunities to do this, particularly online and for psychosocial and psychoeducational supports, and support groups went online. However, not everyone has access or the ability to have things online. Next slide. So innovations included technology and increasing supports, but again, it often does depend where you live and your personal circumstances at home, whether you have the privacy. Next slide. So there are implications for policy and practice. Those are some are listed there, but we have both short-term and long-term recommendations for not only federal government, but our state governments. And these can increase what PHNs can commission and what our organizations can be able to provide. Next slide. So here are the short-term recommendations to review practices in inpatient and clinical sessions to ensure family inclusion and partnership, the creation of carer peer navigation roles. As Richard mentioned, navigating the system's complex, and at the point of crisis is not when we even know that that stuff is there for us. So it needs to be more broadly known in the wider community. Anyone can become a family carer at any time. And prioritize the creation of care on-call roles. Fund available and responsive mental health care respite, which I mentioned before. And in our planning for current and future major disasters, whether they're local or whether they're wider spread in our jurisdictions. And this also means that the responders need to be aware of carers and mental health carers. Next slide. Some long-term initiatives are mentioned here that we bring to your attention. These are all doable, and these are evidence-based, not only through our research, but other research. Next slide. Why am I mentioning all this now? How can you make the most of this information now? Share the research report with your teams, with your colleagues. Use the report and its recommendations to inform your own advocacy, your policies, and your practices. Identify the gaps and potential opportunities for current and future programs that you have or would seek funding for to better meet the needs of family carers. And certainly we encourage co-design research. Next slide. This is how you access, and there's a QR code there. The full report, the summary of the report, and we want to certainly acknowledge the funding that came from the National Mental Health Commission for this report. Next slide. Some support services, if anything mentioned in this presentation has caused any distress for you. And the next slide. On behalf of Bipolar Australia, we have online consumer and care bipolar specific support groups. We have specific bipolar training courses available. We have this booklet, Coming Home with Bipolar, and a subsequent one, Living with Bipolar, that were co-designed with consumers and carers and clinicians. So we'd like you to be able to access those supports. Thank you so much for this opportunity to speak today, and look forward to any questions that you bring up. Thank you.
Thank you so much, Eileen. That's a wealth of information in that research report. And you can see some of the chat now that you're not presenting. I think just the concept of being a carer is potentially not known. And I certainly, from my lived experience, didn't see myself as a carer probably up until my mother got on the NDIS. And then all of a sudden I was a nominee and I started to use the language of carer, but I always just saw myself as a daughter. So there's lots of commentary on that, and look forward to discussing some of that more during the chat.
And I have to say, how often are consumers asked if they're a carer? They may not think of themselves as a carer. They're the partner, the sibling, the parent. So although, like in my own experience, like you, I didn't know I was a carer as a person with lived experience of my own mental health issues.
Yeah.
But when my family member became significantly unwell and I started going to courses, that's when I found out I was a carer. So
Absolutely.
that's why, like many of us across Australia, we're doubly blessed, I guess you could say, and we can bring important perspectives to all the research that's going on. Thank you.
Thanks. And thanks, Chris, for actually raising it. And I'm just picking up that Alex has also mentioned that the Australian House of Representatives has just tabled its inquiry report on carer recognition. One recommendation is to recontextualise carer definition as a care relationship with the consumer. So thanks for sharing that as well, Alex. Just a reminder that if you have any questions, then please do post them in the Q&A so that when we bring the panel all together, you have the opportunity to ask the panel any questions. Moving now to our third presenter for today, Cheryl Ann Paradella. Welcome, Cheryl. Feel free to put your camera on. Cheryl Ann is a carer peer worker at Southwest Sydney Local Health District, where she works with carers and families within New South Wales Health, inpatient and community mental health. Whilst caring for her 2 adult children and husband, she also works as a community liaison officer at Glenfield Park SSP School with children, carers and families from diverse lived experience and trauma and coexisting conditions who aren't suitable for mainstream setting. Cheryl is the president for Beautiful Minds Macarthur, a voluntary advocacy service offering support and raising mental health awareness. Cheryl's passion is about supporting carers, walking alongside them in their caring journey. Thank you, Cheryl. I hand over to you.
Thank you so much. Thanks, everybody, for having me this morning. I'd like to acknowledge the people of the nations and also people with lived experience, carers and consumers. As the introduction, I'm a carer peer support worker, and I am a carer of 2 adult children and my husband. And what drew me to fulfill this role is I believe that carer peer support workers see carers in a light that is different to how we see consumers. And earlier when Doctor said that, you know, we don't often get recognised for what we do and the information we can provide in the role of a carer peer support worker, we actually have that luxury of including families and getting them heard and being able to use their voice. So for a carer peer support worker, we see carers for brief intervention periods for issues such as carer burnout, grief, complex family dynamics and advocacy. And we bridge the gap between the treating team and carers as well as other services. So hopefully we provide that, that little space for carers to feel like that their voice can be heard. A carer peer support worker understands that supporting someone with mental health issues can be challenging and overwhelming, as we all know. We often have different feelings and questions. Carers need access to meaningful information and support. Family and friends play an important role in a person's recovery. Each person has a different experience and journey as a carer. And like people have raised before, not everybody sees themselves as carers. We often say, no, I'm just their mum, I'm just their sister, I'm just their wife, husband, daughter, whatever it might be. And a carer's role means different things to different people. So what a carer peer support worker is somebody who has lived experience of caring for someone with mental health issues. We're employed by the mental health services, and we're able to support and advocate for other carers. There's only 1.5 of us. My colleague works 5 days and I work 2 days. And that's for the whole of Southwest Sydney, LHD. So for inpatient and community. So it's a huge area. How can we as a carer peer support worker assist? We provide support and understanding, linking carers with carer support, counselling, advocacy services in the community, talking to the person with lived experience of caring for someone with mental health issues. So asking them, what is it that they need? How can we support them? So we actually ask them what it is that they need. And often we get told, I don't know what it is. I just need somebody to listen to me. And often that's what we're there for. Talking to the person and providing them with information. So sharing the information that we've gained or able to provide them is extremely important. Also empowering them to ask questions, also feeling like they have a voice, being able to be heard. We're able to give them feedback about the service and the person you care for is receiving. So we're able to bridge that gap between the treating team and the consumer, because often the information that might get a little bit mixed up along the way. Taking your suggestions and concerns to meetings and mental health services, going with the carer to talk to staff about concerns, and linking the carer support counselling advocacy services in the community so that once their loved ones have been discharged from inpatient or community, that they still have that ongoing support, and advising you of the rights and responsibilities of a carer. Because as we know, a lot of the times we don't feel that we have any rights or that our responsibility is just to care for our loved one. Confidentiality and protecting a person's privacy is also extremely important. The carer peer support worker will speak to the carer about what that means, the limitations and confidentiality, and expressing that if we believe that the carer also needs some sort of external supports, we're able to link them into referrals and provide that opportunity. So that's basically about what I do in my role as a carer peer support within the LHD service. And I believe that having the opportunity to be able to walk alongside somebody is a huge privilege, because I didn't have that when I started as a carer, and I was a mum, so or am a mum, sorry. And my first child, we didn't have any issues with, and then my second child, trying to be an advocate whilst being a mum, whilst being a wife, whilst being everything else, and not having that opportunity or that support to somebody to sit down and say to me, are you okay? How can I help? Navigating the maze of the mental health situation hasn't changed, and it's difficult and it's hard work, and when we're in the midst of it, it's so tiresome having to tell our story over and over and over again as a carer. Can provide huge trauma and can also bring up lots and lots of lived experience for ourselves. A lot of carers also suffer their own mental health illness, and sometimes that gets either dismissed, looked over, not treated, because they're in that midst of caring for somebody else. So that really, in a nutshell, is me. Thanks, Eileen.
Thank you so much. There is a wealth of information that our 3 panelists have shared with us. So I'm actually going to ask our 3 panelists to come back on camera and we can have a bit of a Q&A, and I have a couple of questions from the audience as well. Wonderful. Thank you so much. So let's start with one question that came through. Bear with me while I pull it up. If Eileen's already answered it in the Q&A, but let's just ask the question out loud so that everyone else who hasn't quite asked it. If people do not recognise themselves as carers, what, if anything, did the research suggest using? Evelyne, can I hand that one over to you?
That's an excellent question. Thank you. Not that any question's dumb, it's not, but that's really appropriate. In research literature, generally, that's about anything to do with carers in general, the term hidden carers is usually used. I'm not sure that term communicates clearly. All of us are in relationships. And look, this can apply to not just mental health carers, but those caring for elderly parents with dementia or with frail age needs or intellectual disability in the family or any other health and chronic condition, cancers and degenerative conditions. We just see ourselves as family or in a relationship or the friend, the close friend, family of choice, the supporter, whatever the language is that the person refers to. Because there is a Care Recognition Act nationally as well as in most jurisdictions, and because there are supports that are labeled definitely for carers, we can't know that we can access them unless we know that. So that's where, when you're talking to a person using your services, or that might come to you as for your clinical services or your community services, find out what the relationships are and what role they have. And that's where they might find out. When you're offering and advertising your education programs and your psychosocial supports and your support groups like we do for Bipolar Australia, we let people know that, no matter what your relationship is and your support. So when you're doing a survey and you're planning your research, perhaps consider how you frame the question. Not ask, do you have a carer? Ask, who supports you? What's the relationship? What is your role? Do you support others in your family? And see if those kind of phrasing might help people self-identify.
Thanks, Evelyne. I've got two questions for you, Richard. I'll start with the one that Corin's put in the chat, and that is, can you potentially talk to us a little bit more about the experience and supports for young carers who may be caring for a parent while still at school themselves?
It's a very good question, and it's something that we've tackled a few times over the years to try and get support to young carers. Very difficult group to access is our experience. And while we recognise that they're an important group, they're small and very often not connected with mainstream services. We're interested. We do have some young carers on our database. We've got a network database of carers with about 450 carers registered with the organisation, and they fall into various categories. So we have some young carers on our database, and in that way we can target them particularly where we've got a particular activity or support that's relevant to them. But we'd like to have more. We believe that there's a lot more out there that aren't linked into our services. So I can't provide any more information from that about this particular group, but we're keen to support them, but they're a hard group to access.
Thanks, Richard. Evelyne, and then maybe Cheryl, some comments just about young carers who are still at school supporting their parents through their mental health challenges. Evelyne first.
Yes, there is national funding from the federal government for young carers to support them through school, which includes into studies after they finish school so that they can get into education and employment. There's extra funding to help them with extra tuition, tutorial, tutoring, some recreational breaks. There's an organization called Little Dreamers, which also supports young carers that you could look into, and look up the government funding for young carers. It is there. There are bursaries so that they have a life beyond just whatever the family demands and needs are. The fact that they may not know their carers or know they need this to reach children is difficult if they're under legal age. So I think that's something our school system could be more aware of. And when organizations are working with individuals, look at the whole of the family, look at the family needs, and consider that in what you do. Even if it's not your role as an organization, referring people and giving information certainly can be, to make sure we reach these young people and help them have a life that they deserve to have. Also, the COP-ME literature, which is still freely available, which is for children of parents with mental illness, is very available online and very useful to inform everything we do. Thank you.
Thanks, Eileen. Cheryl, from your experience in the LHD, young carers and how they could be supported to support their parents?
Yeah, thank you. I see a lot of young carers both my roles, especially in the Department of Education. And I would like to say that one of the things we do really well as a community liaison officer, I think that at the school, we include holistically the whole family, not just the young person. And what I find happens is that the young person is a carer as well as having their own mental health struggles, and they then miss out on their education because they then have to stay at home to care for either another sibling or the parents, or somebody else that has lived experience as well. From LHD, again, we try and include the whole family and use wraparound services so that it's not just an isolated organisation that takes care. And I talk about, psychologists and stuff like that. If you're going to speak to the person who has lived experience or is living with mental health, make sure you speak to the whole family and get treatment for the whole family, because they're the ones long term that are suffering, and the pressures and the outcomes. And a lot of our young carers miss out on a lot. And I know Eileen said that there's all these online things, and Little Dreamers are wonderful, but if people don't know about it, they can't access it. And then that's why we've got such a high rate of young carers becoming unwell themselves.
Yes, absolutely. Eileen, one more comment from you, and then we'll go back to Richard for another question.
Just to add to that, we can't assume that every young person has access to devices or the data or the permissions from their family to do online things. And there are some programs that are available to organizations and to schools. The SMILES program, which is simplifying mental illness and education for young people. There's a primary program and a high school program that really helps the young people know that it's not their fault that a family member is unwell, and to understand how to relate to it. So I think there are proactive things that can be done besides the online. Thank you.
Absolutely. Thanks, Eileen. And I think, Cheryl, you've pointed to almost the intergenerational trauma that a young person can experience, because they don't know what's going on and they're trying to be supportive, and then it all, they start to kind of go inwards. But, potentially the impact that has for the young person in the long term. So an area of interest and passion of mine as well. So thank you very much for that. Richard, I'm going to circle back to you. You've been in the mental health sector for a long time. What changes have you noticed in terms of carers better understanding their rights, exercising them, and knowing where to go to get support for themselves?
I think we can say that there's been some improvements over recent years with information available to carers and carers knowing. But of course, what we've got to recognise is that there are people developing mental health issues all the time. And In other words, we've got a constant stream of new carers coming along. One of the things that I'm always reminded of is that the people that we engage with mental health carers are savvy carers, in the sense that they've found the organisations that provide them with support, and they've already managed to get themselves linked in with the services. It's the carers that aren't yet linked in with services that I think we probably need to focus on from time to time, or all the time. It's the one of the information packages that we've got up that I shared with you is, how to get somebody an assessment for their in a mental health crisis. We hear lots of stories about a carer who say, well, when my family member suddenly got ill, I had no idea where to go or how to get help. I know that now, but I've had to find it out the hard way. So one of the challenges that we've got as a system is how to get assistance for carers right from the very beginning when the crisis starts. And I don't think we've made a lot of progress in that area. We don't have a lot of information, for example, in emergency departments. I visit a lot of emergency departments, and some of them don't have much information hanging around at all. If you're a carer that's come in, behind the ambulance to support your family member to hospital, it's your first experience. Where do I get information? How do I handle this situation from here? So I don't think that we've made the amount of progress in that particular space that I think that we need to.
It's so important that you say that, Richard, because even if you think about the emergency departments, because we're in such a digital world these days, everyone's just expected to find things online. But in emergency departments, you've got such a captive audience because they're stuck there for hours on end. And if you just had available information, whether it's about diabetes or whether it's about carers, you've got a very great captive audience there that could certainly access and would read that information, because they've got nothing better to do while they're hanging around waiting to be serviced. Cheryl Ann, what advice would you give to people considering entering the peer workforce and navigating the potentially triggering nature of the work, or when it just gets too close for comfort? What's your experience or advice in that space?
Look, I think it's really important to understand why you come into this field and why you work as a peer worker, because there are lots of challenges and it can be very triggering. And I think you need to be have a very close working partnership with your peers and a very good supervisor, and be able to share the concerns as they arise. And I think we need to walk the walk, not just talk the talk. So if we're expressing to carers about sharing their experience and sharing the load, then we as peer workers need to be doing the same. And I think that that's really important, being able to understand that what happens outside of our role, we can't always control, and we're not here to fix. We're not here to make better. We're here to walk alongside and share.
Thanks, Cheryl. I'm going to stay with you. There's a question that's come in from Alex. Hi, Cheryl, invaluable work that you're doing. And I think I know the answer to this based on the 1.5 person that you indicated was working in the LHD in this space. But do you see a need for more carer peer lived experience work in the services?
100%. I am very grateful that we have the 1.5 that we do. But like I say, my colleague is based at Campbelltown Hospital 5 days, and I'm based at Liverpool 2 days. And it's nothing. It is nothing that we can even, scratch the surface of. What Doctor was talking about with ED, I go down to all of the inpatient units, so to ED, and meet with the NUMs, and I go to all of the handover meetings and treatment, teams and meetings and stuff like that. So when you consider that I'm involved in all of that in 2 days, is huge. When you consider that, we have the short stay inpatient units, we have the inpatient mental health units, but then we also have community. And I believe that there should be not only a carer peer support worker, but there should also be a consumer peer worker in every single place in the hospital, starting with ED. And that's where we should be starting. And it should be a 24-hour period.
Absolutely, Cheryl. And I don't want to ask the question, but it's a rhetorical question. It's interesting to think about ratios of consumer to consumer support or peers to peer-led support workers, and also what is the impact in regional, like you've just been talking about Liverpool and Campbelltown, which, can take you 45 minutes in Sydney traffic. It's not that far, but then when you think about it in terms of the regional context, that's
it's huge.
Challenging.
It is huge. And to try and, get, when you consider what we cover from, Bowral to Bankstown. And when you look at, timeframes and time restraints and stuff like that and that, I suppose, just going back to your question before about, how do you support yourself and make sure you take care of yourself? That's probably the most frustrating thing, is like, how do you reach everybody? And there's so many avenues out there that we're not even touching the surface of.
Yeah, absolutely. And I'll ask another question on that shortly. But Eileen, in your experience, what are the most prevalent concerns that carers have over the long term, especially as they start to age themselves?
Yes, you're speaking to one of those. Yeah, even this is the same question I think all carers have, whether they have a family member in the NDIS or not. And we know that the vast majority of persons with mental health issues and psychosocial disability are not in the NDIS. We do have concerns. It can't be presumed that other family will give the same kind of support that you might have as a partner, as a parent, as a sibling, as an auntie or uncle. We can't presume on that, nor should we. Every individual's entitled to their own choices in life and how they live it. And being able to give especially the emotional support that mental health carers give, isn't something everyone in a family or friendship or a kinship relationship can do. And so it is a concern. And I personally think if we had more care-aware workplaces, more care-aware schools, and care-aware community and emergency organizations, so that it's everyone's business to be supportive, not just presume that it's just up to one person in a family or friendship to do that. I personally think that the more we focus on strengthening all Australians in their mental health and social emotional well-being and work from a preventative framework, we might have a better future. But as Richard, I think, pointed out, there's always going to be people who develop or have emerging mental health crises or issues. There will continue to be family and friends who are affected by those issues. So the more responsive all systems across the system are to that, and include the holistic of the whole of that family and relationship structure people have in a community, the better the outcomes will be for all of us. And I certainly hope we have a better healthcare, aged care system as well.
Absolutely. Thanks, Eileen. I might ask one question and get each of you to consider your thinking around it. I guess bearing in mind that almost everyone at some stage is going to become a carer of some sort. If you had one thing, this is the $1 million question, if you had one thing that you could ask government a major difference to carers, what would that be? Who already has an answer that they would like to kick off with first? One thing that you would want to invest in to support carers, what would that be? Richard.
That's a good question. I'm not sure I can come down on one thing. I think one of the things that's been touched on today is respite. It comes up perennially as an issue for carers to try and relieve the burden on them from long-term caring. And that's something that we don't have a good system of at the moment. As Evelyne pointed out, there was a respite system prior to the NDIS, but it disappeared in the reform agenda and hasn't re-emerged at the other end in a clear manner. So respite would be one, but again, help with navigating the system is the other. And I don't know what the one thing is that would be to help carers to navigate the system, particularly carers of somebody who's newly got a mental health crisis. So the one thing would be, just help in navigating the system.
Perfect. Thanks, Richard. Two succinct ones. I'm going to summarise all of these and share them at the end. But maybe Cheryl, if there was one thing that you would want the government to invest in to support carers more so, what would that be for you?
I think I agree with Richard about.
Oh, you can't use one that's already said. You've got to add a new one.
No, I'm going to add. I'm going to add to it, but I think I do. I do agree, but also I certainly believe that we need more carer peer support workers, and we need the funding to recognise the work that we do, and not be brushed aside as the responsibility that we have, and the money needs to be injected in that holistic approach from the very beginning, like you said, Richard, from the very onset of somebody stepping foot into asking for help. That money needs to be readily available for the help for them, to not try and search it.
Evelyne, I was wondering if I might just add to something that to this debate. In the preparation for the project where we developed our information packages for carers, we did some surveys of the service providers in the LHDs and also the Family and Carer Mental Health Program on how their system informed carers, and the question was about the Mental Health Act. In other words, when somebody's admitted to the hospital, the ED, or the mental health unit for the first time, how do carers get information? And it was very depressing, to tell you the truth, about what we got, the information that we got. There isn't a single system within the mental health system about how carers get informed about the system. The majority of responses said it's up to the health professional to explain the mental health system and the Mental Health Act to carers. And the other respondent said, and we do it very badly. One respondent said, they didn't teach us anything at university about how to talk to carers. So a lot of us don't feel comfortable doing that. So that's one of the big areas that we need to explore. How do carers get information? Emergency departments are cowboy countries as far as carers are concerned. It's not a good look on the way that a number of EDs manage families in crisis when there's a mental health crisis. So,
thanks, Richard.
Sorry.
And we've got a couple of minutes left, so I want to get something from Evelyne, but one quick comment, Cheryl, from you.
I was just going to say, Richard, hopefully that's starting to change, because part of our role is actually going to educate new nurses, new doctors, new clinicians about carers' roles and responsibilities and the Mental Health Act. Thanks.
Evelyne, one golden investment to support carers, what would that be for you?
Well, I fully agree with what's been said, but I'm going to raise the big R word, research. There's not a lot of Australian research into mental health carers. There's a lot of research about carers in general, and it all applies to mental health carers, but we actually need the specific research about mental health carers because our government will only fund things that are evidence-based, and their idea of evidence are things that are researched through a more academic lens. But that's not to say it can't be carer-led, as we did with the and consumer-led, as we did with the National Mental Health Consumer Care Forum national research that I presented today. And the other R word I have to say is, although there's recognition, carers want to be listened to, they want to be heard, and they want to feel that what they have to say is being taken on board and used, not as a throwaway line. There's a recognition, which is kind of like, fine, I'm glad you recognize me, listen to me. And I think that's what most mental health carers are not getting. So, yep, all the R's, respite,
Yes,
research,
absolutely. You've got
recognition,
3
rights,
R's.
the
Yes.
4 R's, the
4
4 R's.
R's. Okay. Thank you very much, Eileen. So in summary, I mean, I think Eileen's taken that away, but we've got the right respite, research, recognition and rights, and, you know, things like navigating the system, getting access to more information, more carers, more peer support workers, more funding for what's already being done, and injecting holistically in the system. So I think that is the general summary of it. Please join me in virtually thanking our presenters, Cheryl, Dr. Richard Baldwin and Eileen. Really appreciate the time that you've taken to share all your wealth of information and experience with us. I also would like to extend a thanks to the MHCC team behind the scenes who make the Advocates and Allies webinars possible. In particular, Corinne Henderson, Kate and Katie and Annika. Thank you very much for the work that you do, as I said, to make these webinars possible. Just a few closing comments in the 1 minute that I have left. This webinar will be available in a few days from MHCC's website. The presenters, the 2 that presented with slides, have given permission for us to share the slides, so we will be doing that. And all the participants that are online, you'll receive an evaluation following the event, and it's really important that you help us by completing it so that we can continue to improve these and just get topic interest areas for future webinars. So thank you very much. For those of you who celebrate Easter, enjoy the Easter ahead. And for those of you who don't, I hope you have a wonderful mini break anyway. Thank you very much for joining. And that brings the Advocates and Allies 11th event to the end. Thank you very much.